Matt had a quite complex surgery. He had both sides high tibial osteotomy. So initially, Matt came and see me with bow legs, and then we had managed to straighten his leg out. Now, straightening legs out is a relatively common operation, and usually we do one leg at a time. But for Matt, because the deformity is quite bad, and Matt is very young, he want to go back to work, so he want to have the surgery once instead of have the surgery twice, and have recovery once instead of twice. So we come up to the conclusion that we will straight both of his legs at the same time.
I asked firstly if I could have it all done in one go, so there's less time off work, and just because of the alignment side of things, if I got both legs done, they're both straight, I could start from the beginning. From the beginning, the physio lab worked. When my bandages were removed on the first second day of the operation, you notice where the swelling was, where it was getting, the legs being trapped by the bandage. I also put the physio lab on, and then that with one 30-minute session, I ironed out that lump, and then you can see straight away that it was what it could do.
I think it made a big difference because usually after operation, when the leg really swell up, it really affects the range of movement. You won't be able to bend the leg as much. So therefore, you won't be as confident to use your leg. You won't be as confident to do the exercise with the physio. And I think that had made a difference.
I was walking well with crutches after 2 weeks, and within 3 weeks, I was off my crutches and actually walking. So that was all down to the fact that after 2 weeks, the swelling was gone, and I could start building strength into my legs.
Before we're using the PhysioLab S1, recovery is a little bit longer. Especially it's down to the swelling after the surgery. And what we're essentially doing for this surgery is we're breaking Mark's leg and actually straightening it again. So it is almost similar to when you have a car crash, you have a fracture to your tibia. And actually you had it on both legs. So that's that. I would not expect you to be able to walk properly for at least 6 to 8 weeks. But now we're meeting at 3 months down the line, you're back to work, which is absolutely amazing. And I think this is down to rehabilitation, and the sooner that you can start walking, the sooner you can do the exercise, and the sooner we can reduce that swelling, the sooner you can get recovery. The sooner you can recover. And I think in this context, the PhysioLab S1 have really made a big difference in terms of reducing the swelling, reducing the pain, and to enable us to be able to deliver this to Mark.